Namaste all. I am Dr. Arvind Ramkumar, a surgical oncologist at Bangalore. Today I am going to talk to you about uterus cancer and specifically about cancer of the uterine endometrium. If you have a lot of questions in your mind about cancer of the uterus, then this is the video for you. Please watch it till the end to learn more. You can see the anatomy of the uterus. You can make out the various parts. You can see the body of the uterus, that is called the uterine corpus. Then you can see the mouth of the uterus, which is protruding into the vagina, that is called the cervix. You can see the vagina, the fallopian tubes and the ovary. In this talk, we are going to see cancers which come from the body of the uterus. We are not going to talk about cancers which are coming from the mouth of the uterus, otherwise called the cervical cancers. We are going to see cancers of the uterine corpus or uterine endometrium. According to the report on cancer statistics from the National Cancer Registry Program in India, the cumulative risk of developing any cancer in women in India between the age of 0 to 74 is 1 in 6. This is quite a high number. According to the cancer statistics report from National Cancer Registry Program, it is projected that 1 in 9 Indians will develop cancer in their lifetime. And 53% of cancers in women will be from the top 5 cancers, that is breast, cervix, ovary, uterus and lung. It is important to know the risk factors for uterine cancer. Obesity and the resulting metabolic syndrome including diabetes, polycystic ovarian disease, a small fraction of patients because of genetic conditions such as Lynch syndrome, medical use of hormones, endometrial hyperplasia, certain types of it. These are the principal risk factors for endometrial cancer. There are certain protective factors against endometrial cancer. They include getting rid of excess weight, physical activity, and it has been shown that the more number of children a woman has, the lesser the chance of endometrial cancer. And also, breastfeeding reduces the risk of endometrial cancer. Endometrial cancer is mostly a disease of postmenopausal women. In these patients, it can usually present as bleeding after menopause. It is very uncommon in premenopausal women, but one should think of it in case of abnormal uterine bleeding in premenopausal women as well. Transvaginal ultrasound is a key test in the diagnosis of endometrial cancer. The ultrasound probe is passed into the patient's vagina and multiple parameters are checked, including the endometrial thickness. Based on the report of the transvaginal ultrasound, we'll be able to decide whether a biopsy needs to be done. There are two ways of doing a biopsy. One is a office-based procedure which can be done in the outpatient, that is called using an endometrial pipple. I will show you an animation video at the end of this talk which will explain to you how a pipple biopsy is done. The other way is to do a hysteroscopy and a dilatation and curettage or a biopsy. In patients in whom endometrial cancer has been confirmed by biopsy, they will require additional tests like contrast MRI of the pelvis to assess the local extension of the tumor, as well as CT with contrast of the abdomen and pelvis to check for spread to other organs, lymph nodes and so on. There are two common precursor lesions for endometrial cancer, that is endometrial hyperplasia. The one without atypia has a low risk for progressing into cancer, but the one with atypia has a high risk of cancer, and in some cases there may be cancer already lurking in the endometrial hyperplasia with atypia. In patients with endometrial hyperplasia without atypia, non-surgical management may help, but in patients with atypia, surgery is required in the form of a hysterectomy. Treatment of endometrial cancer is predominantly by surgery. In early stages, just a hysterectomy with removal of the fallopian tubes and ovary will be sufficient. In slightly more advanced stages, a lymph node biopsy, either a form of sentinel lymph node biopsy or a systematic removal of pelvic nodes and the upper abdominal nodes called the parietic nodes may be required. In early stages, minimally invasive surgery could be done, which could be in the form of laparoscopy or robotic surgery, but in more advanced stages, the surgery is generally open surgery. Depending on the stage, some patients may require additional treatment in the form of chemotherapy and radiotherapy or both, and in more advanced or recurrent cancer, hormone therapy and immunotherapy may also be used in certain patients. This product video will show how endometrial biopsy curette, which is disposable, which is used in the outpatient setting to obtain an endometrial biopsy and sample for cytology. To summarize, it is important to be aware of the risk factors for endometrial cancer, like improving physical activity, getting rid of excess weight, taking hormone medications only in consultation with the physician, and quickly seeking medical help in case of postmenopausal bleeding. In endometrial cancer, if suspected, the patient should consult an oncologist for comprehensive management. Thank you.